I'm sure that you've seen the Senate version of the big, beautiful bill. What are your thoughts about the 3.5% cap on medical provider taxes, which, as I'm sure you know, is much different than the House version, which just freezes the states at the current tax rates?
Yeah, that needs work, is my reaction. We've got to protect rural hospitals. Almost 50% of our hospitals in Missouri are rural. Heck, I grew up in a town of 4,000 people where we had one of those rural hospitals, and I don't want to see any of them close. So there's work to do on that. I will say, when it comes to healthcare and healthcare access, RECA is in this bill, and that will mean increased access to healthcare for thousands of Missourians in the St. Louis and St. Charles areas, but all around the state. Anybody who's lived in the St. Louis and St. Charles area and has contracted a disease associated with nuclear radiation gets compensation under this bill. This is a big deal. It's a big step forward. So I'm delighted about that. We got to make sure we protect our rural hospitals so people can get the healthcare treatment that they need when they need it.
What are your thoughts on the House version that freezes or bars states from raising their taxes? From talking with the Missouri Hospital Association spokesperson, that is the least bad option, but they still are not wild about it simply because it gives them less flexibility to raise and lower the tax based off various situations.
Yeah, and there's some technical issues that needed to be fixed on the House side. I mean, at this point, the Senate, you've seen what the Senate is proposing to do, which is frankly a mess when it comes to rural hospitals. I mean, we can't allow rural hospitals to close. So my view is this, that I'm open to any proposal that will safeguard rural hospitals, but I'm not going to support something that closes them. Just like I've said, I'm not going to support Medicaid benefit cuts. Now, there are not Medicaid benefit cuts in this version of the bill, which is good, but we got to make sure that hospitals are open so that people can go get the treatment that they need, and we certainly don't need them closing in rural parts of our state. So as I say, there's some work to do on this, and we've got to get after it here.